Hello everybody, Zach Couples Physical Therapist here, and folks, if you are someone who's dealing with your left shoulder being lower than your right and you're wondering, why did this happen to me and what the heck can I do about it? Well, your boy Big Z is going to cover that in today's video because, folks, it is actually more common for folks to have the right shoulder lower than the left. And although there's factors like, being right-handed and things like that, it doesn't tell the full story. I'm going to give you the full story today. We're going to go into why the left shoulder could, in some individuals, be lower than the right, what biomechanical limitations could be present in this specific instance, and most importantly, what you're going to do about it. I'm going to give you 3 of my favorite moves that will help even out the shoulders, improve your movement capabilities in your shoulders and your thorax, and make sure that no one will mess with you. Let's dive into that, shall we? Believe it or not, folks, uneven shoulders is actually quite common and to some extent might be normal. And there's a few reasons why this is. The big overarching reason is because we are asymmetrical creatures, meaning that we have asymmetrical organs, we have hand preferences, etc., etc. And all of those factors influence the degree of unevenness of our shoulders. The liver on the right-hand side of our bodies makes that side of the diaphragm a little bit easier to dome, so we load on that side a bit more because it's easier to breathe. And that can make the right shoulder appear lower than the left. Other factors that could contribute to that can be increased muscle mass on that right-hand side, especially for right-handers, and the sports you choose. In fact, there was a study done that demonstrated that overhead athletes generally have a scapula, depending on what their hand preference is, that is a little bit more anteriorly tipped and internally rotated. That can contribute to that uneven presentation, especially if the right shoulder is lower than the left. And in fact, that presentation is the most common. And it's these factors that may also be contributing to why a right-sided scoliosis is far more common than a left-sided one. But then we have to ask, Zach, the title of this video is about the left shoulder being lower than the right. You're talking all about the right shoulder being lower than the left. What gives? Well, the reason why I'm talking about right being lower than left to start is because that is our preferential bias based on our natural asymmetries that we possess within our bodies. And I also have to say that because those factors that I had listed, aside from sports preference and hand dominance, are not modifiable. Like, you just can't go and flip-flop your organs unless you're born that way. Lady Gaga, what you gonna do about it? And the reason why I say that is because if you see someone who has a left shoulder that's lower than the right, that generally has to occur via a different compensatory strategy than if the right shoulder is lower than the left, because the axial skeleton has to work around the inherent organ asymmetry that we have within our bodies. And although that same study that I had mentioned previously demonstrated that athletes who utilize their left hand for their sports were able to get that scapular position, it doesn't explain the step-by-step biomechanics that could have allowed them to change the orientation of their thorax to be able to get there. That's what we're going to go into next. But in order to grasp that, we have to look at how the axial skeleton, so the spine and the rib cage, is influenced by the organ asymmetry that we have within our bodies. A study that looked at imaging of normal spines, meaning non-scoliotic, that had normal organ presentation, demonstrated that from about T4 to L5, there was a rightward spinal rotation present. And then at T2 to T4, they had a counter rotation back to the left. Another supporting study also demonstrated, because of the organ asymmetry, that there is generally a right side bend that is present in the normal non-scoliotic spine. So we can see, folks, that normal anatomy involves a spine that is rotated predominantly to the right and side bent to the right. And then in the uppermost segments of the thorax, T2 to T4, there begins a counter rotation to the left. this would make sense and be at least one explanatory factor why a right shoulder being down is more common than a left shoulder being down. And we have to know these starting conditions so then we can figure out, well, how in the heck is the left shoulder now getting lower than the right? Well, now you might be thinking, well, that T2 to T4 leftward rotation is kind of interesting. Maybe if that's magnified, that could create a counter twist to the left that would allow that left shoulder to drop. And in fact, some people argue that. Some individuals will argue that if I have increased right-sided neck activity, that what that will do is that will cause the upper, 4-ish ribs or so to rotate excessively back to the left. And what that will do is that will allow the shoulder to be able to drop on the left. However, I think there are some inherent flaws with that line of reasoning. And there's two reasons why I think that logic is flawed, and I think there's a better biomechanical explanation instead. Reason number one, the first rib really screws up that theory. And the reason why the first rib screws up that theory is because it's a synarthroidal joint. What that means is there is no synovial fluid within the first rib. In fact, it's mostly a fibrocartilaginous joint. And so if there's no synovial fluid in the first rib, that means I can't really have any relative motion of the first rib independently of the other ribs. In fact, what's going to happen is when I move the first rib, instead of the few upper ribs moving, you get a levering of the entire rib cage when you mobilize the first rib. So when you're doing your first rib mobilizations, if you are a clinician, you're actually pushing the entire rib cage downward as opposed to just wiggling the first rib. That's because the first rib can't wiggle. Therefore, if I have a situation for whatever reason where I have increased muscle activity of stuff on the right side of my neck, it's not going to move the upper four ribs. No. What it's going to do is it's going to lever the entire rib cage as a unit to doing this. Which, does that look familiar, folks? Oh, well, I think that appears to make the left side of the thorax lower than the right, which could explain why someone's left shoulder could sit lower than the right. If I grab the first rib and I just do this to the rib cage, that's going to give me the presentation that I'm looking for. And it's not because I'm getting this counter twist to the left in the upper ribs. No, that's normal. It's because I've increased muscle activity on that right-hand side to create a compensatory side bend to the left. And what that's going to do, folks, is that's going to give the appearance of the left shoulder being lower than the right. Now, the other reason why I think that you're not going to have the upper four ribs twisting back to the left is because of the sternal attachments of ribs 1 through 7. Ribs 1 through 7 share a common direct attachment to the sternum. And that direct attachment to the sternum is going to cause those ribs to generally move together as a unit, not a counter twist of the upper four. If you had a twist of the upper four, you'd have this twist through the middle of the bone of the sternum, which I find to be very uncommon unless there was some type of traumatic event. Now, there is the manubriosternal joint, which is between rib 1 and rib 2. So you got the manubrium, which is right there, and then the body of the sternum there. You can have some interesting changes that occur there in individuals, but that's because it's a joint. I'm likely not going to have it in the centerpiece of the bone. And so that's another reason why I think the counter twist of the upper four ribs is likely not what's going on. Instead, the more plausible explanation for why a left shoulder could be lower than the right is because of the thorax side bending in a compensatory fashion to the left without, and this is key, folks, without having any intersegmental or relative motion of the ribs occurring to get there. And what I mean by that last point, folks, is because in a normal side bend, I'm going to get closing of all the ribs on one side and opening of the ribs on the other. If I lock the rib cage in place and I move it as a unit, I can orient the rib cage to the left without having those relative rib motions occur. We have to ask ourselves, why is this happening? Is it because our body hates us and we have these evil muscle imbalances that are causing all these problems? No. always ask the question when there's some type of compensatory activity that's occurring is, why is that useful? Because the body's going to do that for an inherent reason. And so we have to look at, well, why would side bending to the left be a useful strategy to occur? And it may be, folks, because that individual might not be able to create a relative motion, meaning they might not be able to express all the motion at a given joint. And so what they're going to do instead is they're going to change the orientation of their body to allow that individual to get into a particular position that they might not be able to otherwise. Let me unpack that for you. We'll use my shoulder external rotation as an example of that. So normally you should have about 90 degrees of external rotation, right? What if I can't get there though? Let's say I only had that amount of ER. Well, what I could do to cheat my way into that position is I could arch my back to get into that position. And now it looks like I have external rotation, but I don't. I don't have the external rotation that's being expressed at the glenohumeral joint. Instead, I just changed the orientation of my thorax to allow me to get into a position that creates a pseudo external rotation. A lot of times you might see that in someone who's an overhead athlete who maybe wasn't able to get into the fully externally rotated position, or they might not have been able to have the bony adaptations occur at the humerus to allow that to occur. And so then what can happen is they might actually just end up tipping the thorax backwards in order to create that externally rotated position. So basically, orientation changes occur when I can't create a specific range of motion in a given area. Now we have to ask, what type of range of motion improvement, right, in scare quotes, could I get with a side bend? And the answer, folks, is internal rotation. Generally, the side bending action occurs in the mid stance of gait, which is where I create most of the internal rotation within my body. And I'll actually show you this right here. So watch this, folks. And this is very easy to see on your boy because I don't got much internal rotation. So if I face you this way and I internally rotate, looking a little sus, isn't it? But watch what happens if I side bend to the left. Well, now all of a sudden I've just picked up about 30 degrees of internal rotation, didn't I? But I didn't. Instead, I just changed the orientation of my thorax to allow me to get more internal rotation on the right-hand side. And conversely, if I side bend to the left and I see how that improves my ER, watch this. I can also get a little bit more external rotation on that left-hand side. So what a left side bend of the thorax is going to do is it's going to change the orientation of my body so I can pick up left external rotation and pick up right internal rotation. Well, now, does it make sense maybe why an overhead athlete who's left-handed might have a shoulder that's dropped to the left? Think about most of your overhead sports, folks. You've got to have a lot of external rotation to be able to create the force production needed to throw a ball hard, hit a racket, whatever sport it is. And so if I have someone who can't get that, it would make sense that they might change the orientation of their thorax to make it easier to create that external rotation. To recap the major points of the biomechanics behind this problem, the left shoulder is going to appear lower than the right because of a compensatory side bend of the thorax. If you see that left side bend, chances are it's because there's a loss of right shoulder internal rotation and left shoulder external rotation, and that individual is just side bending the thorax to make up for that compensatory loss of relative motion. And so the fix for this type of individual is we actually need to restore right internal rotation and left external rotation to reduce the side bending action from occurring, and that theoretically could even out the shoulders. Now we have to look at the steps that we're going to have to take in order to make that happen. Well, if I just did an orientation of the thorax this way, I'm likely going to have to expand anteriorly on the right to allow me to get more internal rotation. I need to do some things because remember, folks, the first rib and the right neck is going to lift up that thorax to the left. I'm going to have to do things to get my right neck to chillax. And then, of course, I need to create expansion in the rib cage in as many directions as possible. And that's where coaching the stack is going to be useful. So the three major keys that we're going to need for this is we're going to need to stack first. We're going to need to create right internal rotation and expand the right anterior part of the thorax. And then we're going to be doing a lot of looking to the right to get the right neck to chillax. And if we do those three things, that's going to do some incredible improvements for us, and it's going to minimize the side bending action that's occurring. Let's now go into my three top moves that we can use to reduce this uneven shoulder presentation. Now, what we're trying to do with this first move that I'm going to start with, which is a side lying armbar hold, is I want to reach with my right arm so that way we can restore some internal rotation action on the right, but we're going to do so very early. And then I'm going to use gravity to expand the left side of my body. Because remember, if I'm side bent this way, I'm closed on the left, I'm relatively open on the right, I need to flip-flop that. So I need to make sure I get that expansion on the left side first, because I don't have that. That's one reason why I side bend in that specific direction. And so what I'm going to do for this arm bar is I'm going to use my right arm and my right leg. So I'm going to do the right side for this. I'm going to reach on both. When I do this reach, so I'm going to reach the knee across, the arm to the ceiling. That forward reach is an internal rotation action. Remember, even though internal rotation might be full or good, it's phony because of the side bend. So you're going to roll. This leg is going to go to the side like that. I'm going to reach my arm to the ceiling. Now, as I'm doing this, folks, a common mistake people will make on the arm bar is they'll go way back like this. You want to keep it over the top of the torso, just like so. Now, I'm in this position. With my left hand, I'm going to pronate and I'm going to keep it at about 90 degrees. This is actually going to help recapture some of the internal rotation deficit that can sometimes occur because of the side bend. So I'm going to just keep my arm IR'd on this side. I'm going to look up to the kettlebell. When I look up, that's going to engage the left sternocleidomastoid, or the SCM, and it's going to keep the right side relaxed, because remember, we've got to get that right neck to chillax. I'm going to hold this position. I'm going to breathe silent in through the nose. As I exhale, I'm going to reach to the ceiling, like that, rinse and repeat. You just want to hold and keep reaching. A common mistake that people will make on this arm bar is when they do the reach portion, they'll just sag down like this. You got to keep this long. If you can't keep the arm long, then you'll want to go with a lighter belt. And so you're going to start with that move and then move on to the next one. Now, before I show you this next move, you might be thinking, well, Zach, I don't really know how to test range of motion all that well, and I don't really have a good model to put some of these restrictions that I'm seeing together. Or maybe you've played with some of these moves on your own, but you're not coaching them to the level that you want, and you might need some help. Well, your boy, Big Z, has some help for you, and that help is, folks, Human Matrix, my seminar. If you are watching this in 2022 and you want to get a comprehensive movement model so you can be laser-like with your exercise selection and help more people enhance their movement capabilities, or if you want to improve your ability to coach many exercises, not just these breathing ones, but ones in the gym, things like that, so you really get the most out of your exercise program, or folks, or if you want an assessment that will help enhance your exercise selection so it is mo better, then you want to check out my seminar, Human Matrix. If you're watching this in 2022, there's a few dates available. I'm going to be in Seattle on May 28th, 29th. I'm going to be in Boston August 6th and 7th. If you are watching this in Europe, I'm going to be in Slovenia October 15th and 16th. There might be more dates to come. On to the next move. In the arm bar, we're kind of using the side lying position to increase anterior and posterior expansion in general. Now what we want to do is we want to progress the internal rotation demands in a more difficult scenario. I'm going to use an elevated side plank to complete this. Now, here's how this elevated side plank is going to look. What you want to do is you want to be in half kneeling for this. I'm going to do my right side, so I want left foot forward. With my half kneeling, I'm not in this big, crazy stance. You want to keep it fairly narrow. You're going to take your entire forearm, you're going to put it down on a bench. You want to make sure that your hand's flat, everything like that. If you're someone who gets this like little arch in your wrist as you get there, or you notice that your index finger is coming up, I would just put a towel on the inner border of your hand. You're going to look down. That's to get the right neck to chillax. You're going to slowly push just like so, not falling back this way. I want to reach so I get a little bit of my right abs engaged. I'm looking down, 5 breaths in this position. Same song and dance breathing wise. The final touches for this particular movement is going to be an offset quadruped position, and I'm going to have my left hand on the DC block or book or whatever it is that you're using. Now the reason why I'm doing this is because when I'm in an offset quadruped, I'm theoretically reaching further forward with my right than my left. If I reach forward, that's going to increase internal rotation that's available on the right side. Subsequently, when I turn to the left, that's going to give me left posterior expansion, which will help restore the ER. Because remember, the side bend is happening to make up for those movements that are lost. So even though the left shoulder might present with full ER and the right might have pretty good IR, damn dirty lie. Don't trust them. So what you want to do is you're going to put left hand on the box, right hand's going to be off. And just so you can see, my stance width is about shoulder width apart with my arms and my hips for that matter. So I'm here like this. I'm going to keep my chest parallel to the ground. I'm going to get a slight amount of kneecap pressure, and I'm going to slowly reach as far as I can without crunching like that. So I'm going to keep that pressure, get a nice full reach, hold position, and breathe. You're not forcing air anywhere. You're just going silent in through the nose. Exhale, long slide, do not sag, or side, do not sag.
And there you have it, folks. Those are the keys to evening out those shoulders, especially if your left shoulder is sitting a little bit lower than your right. To recap, the left shoulder is going to appear lower than the right because of a compensatory left side bend. This left side bend gives the appearance that we'll have more right internal rotation, and we'll have more left shoulder external rotation. And then our intervention selection is going to involve stacking so we can create expansion in the rib cage. We want to compress the lateral rib cage on the right so it expands A to P, especially anterior on the right-hand side of the body. That's going to give us more internal rotation. And then we're going to do activities to get the right neck to chillax. And if we do those things, that ought to help us with some of the uneven shoulder presentation that we have. And it ought to, most importantly, folks, improve our ability to move within the thorax so no one will mess with us. Folks, what struggles have you had with posture? Have there been exercises that you've been struggling with that are limiting your ability to move the way you want to? If so, please comment on the video below. And while you're here, give us a like and subscribe, and go ahead and check me out at zachcouples.com. There we got tons of different videos that can help you with various postural presentations, can help improve any movement restrictions that you have, and take your exercise selection and ability to program to the next level. Otherwise, thank you so much for tuning in. You've been an incredible, outstanding audience, and I hope that you keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.